What's up TRT community? Let's help each other. At the end of this video, I'll be giving you guys a coupon code so that you can save 20% off an at-home testing kit, which actually made the cost less than I've ever spent on blood work, ever. This video has been sponsored by LetsGetChecked. They provide individuals with affordable, discreet, and professional access to at-home health testing. LetsGetChecked makes healthcare and diagnostics open and patient-led, giving you greater control over your health. When everything is working as it should be in the male hormone system, your testosterone will peak around the age of 20, and then around the age of 30, it will start to drop off by 1% per year at a rate so that you should not fall into the area of low testosterone until you're in your late 70s or late 80s. However, if you look at the viewer statistics on my channel, which as you know, my niche is testosterone replacement therapy, you'll see that 99% of my viewers there are male, and most of you looking into TRT are in your mid-20s to mid-50s. The winners there being between ages 35 and 44, and that's where I fall. Actually, I'm 40 years old, and I started TRT last year back when I was 39. Probably started experiencing symptoms of low testosterone when I was 35-ish or so. Now, why is it that so many people roughly our age, mid-20s to mid-50s, are inquiring about if they have low testosterone or not? What's going on? Dr. Augie Galindo of the Testosterone Centers of Texas, through studies that he's done, he said that we're seeing that men from even 25 or 35 years ago, on average, had testosterone levels that were 22% higher than what we're seeing on average today. It's hard to say exactly what the cause of this is. There are a lot of theories out there, of course, and though we don't know right now how to prevent it from happening altogether, thankfully, we do have ways to treat our symptoms. And there are a number of negative symptoms that come from having low testosterone. More than likely, you've already been researching those, and good for you, you should. And sometimes those negative symptoms might not be low testosterone. I can recall back when I was having those low energy and mood swings and low libido, I didn't know if it was low testosterone or not. That's where the at-home test from LetsGetChecked comes in. They reached out to me and asked if I would review their testosterone testing kit that you do from home. It will arrive to you in this discreet packaging, so it just looks like a normal package from anywhere else. So I don't know if you have a roommate or maybe a nosy neighbor, he won't be able to tell what this is. Don't worry, it's not gonna have big lettering across it that says low testosterone testing kit. You won't have to worry about that. He's not gonna call the neighbors over and point and laugh or anything like that. And frankly, the kit is really easy to use. It comes with everything you need to get this sample and get it back to them. Free shipping coming to you, free shipping going back, and it's an all-inclusive pack. It will come with everything that you need. When you open it, you'll keep that little identification card that you find on the top. It's going to have your special codes that you'll use to get your results back when they're ready. Once it's opened, you'll fill out a few little things there on the lid about yourself and your birthday and whatnot. Then you'll want to activate the kit using your phone or using your laptop or desktop at LetsGetChecked.com. Now, during the activation process, they'll ask you some questions about yourself personally. They'll also ask you some test suitability questions. This part takes, I would say, roughly 10 minutes. And you may be thinking, seriously? 10 minutes? Well, guys, think about the kit as sort of like a mini doctor visit. I mean, have you ever gone to the doctor, signed in, and then immediately a nurse is charging towards you with a needle to get blood out of your veins? Probably not. They get your weight, they get your height, they ask you what's wrong with you, finding out all your negative symptoms and how to best treat them possibly. Then they might do some blood work after that. The activation process is really for the purpose of giving you the best quality of help, because they'll not only see the results of your blood work, they'll also be able to, based on your answers, look at who you are and what you're experiencing and have a much better picture of how to help you should your results come back abnormal. Now, as far as getting the blood sample, just follow these directions they send you and it'll walk you through how to do that really easily. You'll start with washing your hands with warm water. This is to not only get them clean and germ-free, but it'll also help with the blood flow to your fingers when everything's nice and warm. After that, you'll do the fun part of pricking your finger, and they provide 4 of these finger prickers for you to have a go at it with. It actually ended up taking me 2 to get all the blood that was needed to fill the vial up to that top line. I didn't have to take as much blood as I thought I was going to have to, but it was still enough that I needed 2 of these bad boys to do it with. Once you get the vial filled up to that top line, it's really important at this point to put the lid back on and then agitate it back and forth 5 to 10 times. They say this is going to help them get the best results from your sample once they receive it back at their lab. After you get your sample, you're going to put that in the biohazard bag, tape that down, put it back into the kit, then slide the kit into the pre-addressed, prepaid pouch that they provide. Wow, that's a lot of P's. And then you will send that back to them. And they'll also give you a little Band-Aid for your boo-boo. Let's Get Checked will also keep in contact with you along the way. It's really cool. They sent me an email when they thought my package was going to be arriving in the mail, and it let me know 2 different ways to get my sample back to them. They said, hey, here's a link if you want to schedule a UPS pickup at your house. Here's another link to find a UPS drop box in your area. And I ended up using that route, and I learned that there's a UPS drop box like 5 minutes from my house. I didn't even know about it, so that was really handy. Thanks, Let's Get Checked. The other way they're really good about keeping contact with you as well is I got a text today letting me know that they have received my sample and that I should hear something back from them in 2 to 5 days. However, you guys are gonna find out in just a few moments what my results were. Well, I got the results back and I'm really happy. I'll tell you why. Because my doctor, he really just recommends that I come in every 6 months, and that's to get blood work done and just see how my levels are doing and if they need some adjusting. But what's really cool is last time I went in, as you guys might recall from this video, my estrogen was a little high. As you see here, my estradiol is now down to 40, where it was at 66.7. So we purposefully have reduced my testosterone. I was injecting 125 milligrams every week, and then my doctor recommended that we reduce that down, and so I'm currently injecting 100 milligrams every week, and so it worked. I'm also really pleased too because my testosterone is fine, but if you look at it, it actually says it's high now, which is funny, but not high like steroids high, 1208. That's down a little bit from what it was too, however, 6 months ago, because as you see, that was my number, and so it's down a little bit, but still not anything like dangerously high. And as you guys know, depending on when in the week you test, you're going to be a little higher or a little lower if you inject weekly like I do, because testosterone cypionate will peak in your system 48 hours later. Throughout the week, it starts to go down a little bit. Well, I did this test about midweek, and so if my testosterone is falling around that number, midweek-ish, you know, I'm happy with that. That's not like crazy high and it's not crazy low either. I'm very pleased. Now, if you're interested in getting one of these kits, you will actually use this link right here. Try lgc.com/Cohen, C-O-H-E-N. That's going to take you immediately to the portion of their website that's all about the male hormone tests. They offer 4 different tests, from the most basic being just a testosterone kit, down to this one, Male Hormone Plus, which is the one that I ordered. It measures testosterone, sex hormone binding globulin, estradiol, and free androgen index. Well, let me tell you what happened with my test. What's really cool is this. Whenever your results are ready, not only will they send you a text letting you know that, but someone that works at Let's Get Checked calls you. And this very nice and courteous lady named Jessica called me and told me, hey, here's your results. However, we were not able to get the test for the sex hormone binding globulin or the free androgen index. She said either you didn't put enough blood in the sample, though I did fill it up to the line, but I guess I should have put in maybe 1 or 2 drops more. She said, or the blood coagulated too much to the point that we couldn't get those 2 things as well. Now, I thought this was really classy of her. Instead of her saying, well, it was probably your fault for not putting enough in the vial, so, she said, what we'll do is this. We'll send you, if you'd like us to, a whole other kit for free, and I'll even expedite it, she said. Let me think about that for a second. Yes. And so I'm really impressed with Let's Get Checked. I thought that showed some character on their part, them willing to say, hey, let us make this right. So let's talk about the pros and cons of the Let's Get Checked at-home testing kit. What have they been? Well, let's start with the pros. Now it's a 40-minute drive for me to go to my doctor, then I get the blood work done there for about 20 minutes, and then I drive back. And so time, this comes right to my house, so that's a pro. Secondly, how you get your blood sample, in my opinion, is way less invasive than how they do it at the doctor's office. As you know, they have to stick a needle into your veins. You might be thinking,
well, dude, you inject testosterone. What's the big deal about needles?
Okay, I don't know why, but for some reason, I'm totally fine with a needle going into my muscle. Needles going into my veins make me almost pass out. I know it's weird. I'm sorry. That's just how I am, okay? I don't know. So, using a finger pricker is much less invasive, and I like that a lot better. Number 3, and this is a big one for me and probably for all of us. Cost. I've never gotten out of my doctor's office without paying at least somewhere around $150 US for my blood work. With the coupon code that I'm going to give you, you'll get 20% off of all of these prices. So with the 20% discount off the Plus kit, if you went the same route that I went, you get it for $127.20. And if you went with the most basic kit you see here, I mean, look at that discount once you factor the 20% off. Because the truth is, some of us want to know what our levels are at between the 6-month visits with our doctor. Sometimes I do, and I did. That's why I got one of these kits. And now I feel really good that my estrogen's down. The 4th thing would be this. The whole experience was very professional. Actually, Let's Get Checked kept in contact with me way better than my doctor's office ever did. They let me know when they got the sample. They then called me to say, hey, it's ready. Let's talk about your results. So I like the fact that they keep in contact with you, let you know how things are going along the way. So I guess the only con now would be the fact that they didn't get my results back to me in the 2 to 5 days promised. Jessica on the phone was extremely apologetic about that. She said they're having a much higher volume than they normally do. And so I would say so far, if there is a con about any of this, it's just been that. It did take longer than what they had originally promised to get the results back to me, but they can't always help it when they have an increased volume that's unexpected, and so I totally get that, and I wasn't mad at all. Otherwise, I'm really happy. Well, as promised, here's that coupon code where you can get a discount on one of these kits. And this code, which is my name, Cohen, C-O-H-E-N 20, will get you 20% off anything on their site. They don't only do male hormone testing, they also have tests for like liver function and kidney function and even cancers and things like that. So I actually have a history of high cholesterol in my family, so I'm considering maybe even getting one of their cholesterol kits in the future. Cohen 20 will work on any of those kits on their site. Thanks for watching. God bless. Peace.